Welcome to the SDK Health Sciences Medical Education classes. Today our topic is problem-based learning. First of all, we will define problem-based learning. So problem-based learning is actually a student-centered small group learning method or process. In this method or process, the clinical scenarios are utilized as actual situation for the student. And they are utilized for what? To build their learning needs, to conduct self-directed investigations, to integrate theory and practice and apply knowledge and skill to develop a solution for a given scenario. This is actually the classical definition and purpose of the problem-based learning. Now, what are the structural components of the problem-based learning? The problem-based learning is actually a group study. It is comprises of a small group of about 10 students, sometimes 6 to 10 students. So it is a small group study. And a group is comprised of three major components. Number one is a leader. Number two is a scribe who write the things. And number three, the rest of the members. The group leaders, so this is scribe and these are the members. The group leader actually, he leads the group. And his selection is based on voluntariness, like voluntarily they select a group leader and with the unanimous agreement of all the members. Similarly, a scriber is one who take notes and his selection is also based on voluntariness. He volunteered himself and the unanimous agreement of all the members. And rest of the students, they are called members of the group. The session is facilitated by a facilitator or by a tutor. Who is process expert actually, Simultaneously, if the teacher is subject expert as well, then this is an additional advantage. So facilitator who is faculty member or who is a process expert and whose role is to guide the students without being as a part for the solution as a primary information source. So he is not involved in the process of solution of the case, but rather he behaves like a guide. He is a guide. He guides the students. The session usually comprises of two components. The session number one is called brainstorming session, and the session number two is known as review session. So this is the chart of the PBL session. There is a facilitator or tutor who is a guide, and these are the students. We have different arrangement. Sometimes the arrangement is circular, sometimes the arrangement is square. So we have different types of the arrangement where the student can sit and so sometimes the arrangement is circular, sometimes it's square. So one of the student is a leader and another is a scriber, and rest of all they are the members. A PBL is comprised of 10 students. So one is group leader, another is a scribe, others are the member, and the tutor behave as a facilitator. Now we have different roles for the different people here in this PBL session. So what is the role of the scribe? The role of the scribe is to record the points and resources that are suggested by the group members, by the members. What is the role of the leader? Leads the group, provide equal chance to all participants, and maintain the group decorum. Members follow the PBL steps, take part the active participation in the discussion, listen and respect the other contributions, and share information. Now, what is the role of the facilitator? The role of the facilitator is to encourage all the students to participate. The role of the facilitator is to help the leader to maintain the group dynamics. The role of the facilitator is to prevent sidetracking or cross-talking. The role of the facilitator is to ensure that the group has achieved the appropriate objectives. The role of the facilitator is to keep an eye on the process. And the role of the facilitator is to assess the performance. So we have scribe, we have leader of the group, and we have members, and we have facilitator. So functional step of the PBL. Functional step of the PBL are like we have brainstorming session, we have a review session, and in between the brainstorming and review session there is a self-study component or self-study session. Now the brainstorming session, this is the first session of the PBL. This is the first session of the PBL where the students, they come and a case scenario has been given to them. A case scenario has been given to them. So let's see what is brainstorming session. This is the first session where the student use their prior knowledge to come up with the different keywords and ideas to formulate objective for the case solution. So during this step, all students are encouraged to speak their mind and all ideas are appreciated and noted. The leader leads the group and the scribe is ready to take the notes. Now, what are the responsibility of all the members in order to maintain the group dynamics? There should be some requirements for the members as well. So number one, the participation will be with the permission from the leader. So anyone who want to participate in or he want to say something, he will raise his hand and he will ask permission from the leader, and then the leader will allow him to speak, and then he will share his ideas. Point number 2, which is the most important one, is the respect for person and ideas. Point number 3, no derogatory remarks. Like say for example, somebody says some point and say, oh, I know this earlier. So these type of the remarks should not be there. And point number 4, the members need to provide the explanation or any idea in a thoughtful way. Not just a point scoring. But no, if somebody is giving a point, or somebody is giving a remarks, or somebody is sharing his idea, so it must be based on some background knowledge. What are the steps of the brainstorming session? So step number 1 is that the leader will invite the group for silent reading. So all the members, they will start a silent reading for approximately, depending upon the case, 3 to 5 minutes. Then once the silent reading has been done, everybody has done that silent reading, then the leader will ask the voluntary participation of anyone to read loud reading by any member. And the rest of the members, they will be focusing and trying to understand the case and marking the difficult words. Once the reading has been done, whether it's by paragraph or whether it's line by line, and the other members are focusing on that, and then they are marking their difficult words. Then there will be discussion and explanation of the difficult words. Once the discussion and the explanation has been given and shared with each other, then the leader will make sure that all members understood the problem. So the leader will ask, okay, everything is okay with everyone has understood the problem? Yes, so okay, fine. Then the leader will ask someone to voluntarily ask the participation to summarize the case with the brainstorming what we have done up till now. And then so they will summarize the whole case. So this was the case. The case has been done with the silent reading, then the loud reading, then difficult words, then discussion on the difficult words. Now they understood the whole case. So there is a summarization of this case. Say for example, I can give you an example that they can give you a simple example. A 50-year-old male came to the emergency department with the retrosternal chest pain for the last 3 hours. The pain is associated with sweating and vomiting. Now this is, say for example, a short case. So the students will read it individually in groups, sort out the difficult words and try to understand the whole situation or the whole case. Once they have done this, then they will move to the keywords. So they will sort out the keywords formulation. Say for example, in this case that I've just explained to you, Say for example, retrosternal chest pain, retrosternal chest pain, or associated symptoms, like this. So they will sort out the keywords, and once the keyword has been done, then the next step will be the formulation of objectives, and these keywords will take you to the formulation of objectives. So what are basically the keywords? The keywords are the point that can take you to make objectives. Keyword dependent objective formations. And what are objectives? Actually, the objectives identify the gaps in knowledge, and that will be filled by next session, that will be your self-study or research session. So in brainstorming session, we cover all these points. We start silent reading, we start loud reading, we sort out the difficult words, we explain the difficult words, we summarize the case, we sort out the keywords, and based on the keywords, we develop our objectives. Once these points have been covered, now this session is end now. Session 1 is end now, and the student will go out. They will disperse for what? For self-study and independent study and research. So, what we did in the brainstorming? Reading, understanding, with the help of difficult words, keywords, and objective formulation. So reading, understanding with the help of difficult words, keywords, and objective formulation. Self-study phase. The second phase is actually the self-study phase or independent study phase, where individuals, it can be done individually or it can be done in the smaller groups, where the students refer to related articles, to works, to lectures, to practical sessions, and to all these resources for what? For to acquire the necessary knowledge regarding that case where they have discussed in the brainstorming session. So they utilize all the resources to bring the answers of their objectives or to solve their objectives. So this phase is actually the objective solution phase or objective clarification phase. Now after 1 day or 2 days, there will be a review session. The third step is the review session. So basically we have two sessions. One is brainstorming, the gazetted or the allowed session, and another is the review session. Self-study is individual. So stage 1 we did brainstorming session, then stage 2 we will come to the class again with the facilitator, and this is the review session. What are the steps of the review session? So again, the review session will start with the voluntary summarization of the case. The leader welcome the group and will say that, okay, anybody want to summarize the case which we have done in the previous session? So anyone can start a summarization of the case, and then this was the case of a 50-year-old male came to the casualty with a retrosternal chest pain for the last 3 hours with associated symptom of vomiting, nausea or sweating, like this. And then for this case, we had these objectives 1, 2, 3, 4, 5, 6. They were count the objectives. Then the discussion, then the leader will ask the group to start the discussion with the explanation of the objectives. And if there is a need, somebody would say that, oh, I want to add something in our objectives, or I want to refine one of the objectives. So it can be done in that time. And then the discussion will start with the objectives, and objectives will be solved accordingly with the in the order. The students will finalize their diagnosis with the help of the objectives. So, okay, this was the case and these were our objectives, and based our discussions, so our diagnosis is that this gentleman who came to the casualty with a 50 years of age with this retrototal chest pain with associated symptom of vomiting and sweating or nausea. So our diagnosis is that he might be suffering from acute MI. So, or the diagnosis is that he is suffering from acute MI. So, the student report and explain their findings for the objectives in a logical manner. The student can present a video clip, a diagram, flow chart, and can use whiteboard for strengthening their discourse or their arguments. Finally, the student close the discussion with the complete explanation of all objectives. If this case is a clinical case, if this case was a clinical case as we just explained, like a case of MI, then they will start with the presenting complaint, history of presenting complaint, that okay, this patient was suffering from chest pain and he was suffering from chest pain for the last 3 hours, and they will discuss the causes of this complaint, what are the basic causes of this. They will discuss the pathogenesis, they will discuss the examination, they will discuss the investigation if this is an MI. So what investigation he would need. So say for example, he might need ECG, he would need the lab diagnosis of or enzymatic assays, enzymatic analysis. Then they will confirm their diagnosis. Once they confirm their diagnosis, they will move to the treatment. So they will discuss the emergency treatment or follow-up treatment. They can also discuss the complications, and last but not the least, prevention and rehabilitation. So these will be the steps if the case is a clinical case and they have their objectives in their brainstorming sessions. So they will summarize, they will explain all those objectives here in the review session. If the case was a basic science case, say for example, then they will go for the definition of the topic, classification related to the topic, pathogenesis and explanation of the process, clinical or medical importance of the topic, reaction related to the topics, and the related clinical condition of concerning with related to that topic. And at the end of the day, the student should review the whole case in totality. So this was the case in brainstorming. The 50-year-old male came to us with the retrocellular chest pain for the last 3 hours associated with nausea, vomiting and sweating. For this, we made these objectives and we sorted out that we need to see the causes, we need to see the pathogenesis, we need to see the examination, we need to see the investigation, we need to see the relevant treatment, then the complication, prevention and rehabilitation. And in the review session, they discuss all these points and then they come up to the final solution that this was a case of acute MI with ECG abnormalities, with abnormal labs. For this, we did an emergency treatment and we did a follow-up treatment. So this will be the end of the session. What will be the role at the end of the session? What will be the role of the what they will do? They will review the whole steps. They will reflect on their own performance of the leader, performance of the scribe and the facilitator. Assessment is a very important component of any educational activity. Assessment drives the learning. So there will be assessment as well. It is one of the important teaching component of the teaching and learning. So basically in the PBL scenario, the assessment is basically a feedback session. So there will be a feedback. A feedback will be given by the facilitator. And usually facilitator used to give a positive feedback, constructive feedback, that what need to what need and what are required to improve the situation. And but in addition to this, in addition to these type of the assessment, definitely in some institution this activity is graded as well, so there are marks for this as well. So if this is a graded activity where the marks are assigned for this and there is a weightage for this activity, then again the assessment can be made by with keeping in view the following points. Number one, the brainstorming preparation. How was the brainstorming preparation? But it was in a logical manner. Participation of the members, critical thinking and logical presentation of the thoughts, leadership qualities, a group dynamic and group communications, and professional behavior and attitude. So assessment will be done on these 6 points, and then the marks will be allocated to every member. So in order to summarize it, PBL is an interactive activity, student-centered interactive activity comprised of 2 sessions. One is the brainstorming session, another is the review session, and in between there is a self-study session. In brainstorming, the students use their prior knowledge, they summarize the case, they make objectives about the case, they make their provisional diagnosis, they make the objectives about the case, and then they go home individually or in small groups. They review the whole case, they study the whole case, they do research of that case, and then once they come in the review session, so they bring a solution for all those objectives and they solve the case. In PBL, we have leader, we have scribe, we have members, and we have facilitator. Leader leads the group, scribe write the notes, member actively participate in the activity, and the role of the facilitator is to help the student to keep them on the right direction and avoid sidetracking and help the leader in a group dynamics and the group decorum. I hope this will help you in your future PBL sessions. Thank you very much. If you have any questions or any comment, your questions and comments are most welcome. Thank you very much.